Yields back. Chair recognizes the gentleman from Indiana, Mr. Bucshon, for 3 minutes, please.
Chairman Burgess, Ranking Member Green, thank you for holding this important hearing today. Opioid abuse disorder has ravaged our communities, and while it is important to look forward and address what else needs to be done to combat this terrible disease, we need to ensure that legislation we have already passed is being properly implemented and is working as Congress intended. In July 2016, the Comprehensive Addiction and Recovery Act, CARA, landmark legislation addressing the opioid abuse crisis, was passed into law. I spent months convening stakeholder roundtables and working on bipartisan language, which became Section 303 of CARA. Section 303 updates the Controlled Substances Act and office-based opioid addiction treatment laws by ensuring that patients are offered and physicians are trained on all FDA-approved treatments. Under previous law, prior to CARA, millions of opioid-addicted patients had their treatment determined based on their setting of care. With the passage of CARA, patients in these settings must now be offered a full range of treatment options based on their individual clinical needs, an individualized treatment plan. Unfortunately, 15 months after the legislation was signed into law, Section 303 still has not been implemented. I urge the committee to conduct strong oversight to ensure SAMHSA will be properly implementing the law. Every day that this law goes unimplemented is one more day that our family members, friends, and colleagues are battling a disease with fragmented and incomplete treatment options. Specifically, SAMHSA should send a Dear Colleague letter to notify physicians that they must offer all anti-addiction medicines based on a patient's clinical needs. Additionally, curriculum for doctors, PAs, and nurse practitioners should be updated to include training on all FDA-approved opioid addiction medications. Moreover, all of SAMHSA's public-facing material, including their website, should be modernized to reflect this patient-centered approach. According to the Evansville Courier and Press, 55 people in Vanderburgh County, Indiana, have died of a drug overdose in the first 9 months of this year, which is more than all of 2016. The availability of all medication-assisted treatments, regardless of where a patient chooses to seek them, will help to stem the tide of these unnecessary deaths. It is vital that as the committee moves forward in the fight against opioid abuse disorder, that we ensure CARA is properly implemented and helping people combat this terrible disease. Mr. Chairman, again, thank you for this hearing, and I yield back my time.